All right, the list that you guys have been waiting for, the 5 hardest residencies in medicine right now. For those of you that don't know, I'm Dr. Hassan, board certified trauma anesthesiologist. It's not even written on this side, it's written on this side, but that's how you know that I'm not some sort of professional YouTuber. But here we go. You're a medical student, you're a nursing student, you want to find out more about the medical field, you want to find out what are the hardest residents inside of medicine. Now let's take a step back. What is residency? Well, residency is the word that comes from resident, which is a person who's a physician in a hospital going through training. Now, why do they call them a residence? Because back in the day, residents, medical doctors in training spent so much time in the hospital that they were considered residents of the hospital. If you didn't know, in the past 20 years, the residency programs have changed a lot, but previously there was no limit on the amount of time you spent in the hospital. You basically left when the work was done, and sometimes the work took 2 or 3 days to complete. When my mom was in residency, she would spend 24 to 48 hours in the hospital in a row. When I got to residency, fortunately, that rule, that antiquated, archaic rule of having people live in the hospital, that had been kind of weeded out. The max amount of hours you could spend in a hospital was about 26 to 28 hours. That's because you would spend a 24-hour shift and then you'd have 2 hours or so to, wrap up things. But even that has been cut down now to the point where you can't really do 24-hour shifts, which is fantastic because, humans are humans and you don't need to be living at work. Especially not every single medical doctor out there doesn't have to be living at work. Sure, there's some, alpha, high achieving, getter, gunners type of individuals who want to be at work all the time and do the best that they can, but the majority of people have lives and medicine is changing, and for the better. So residency has now become a little bit more on par with the rest of the world. But nevertheless, all the residencies are stressful in their own way, and I respect every single one of them. But as an anesthesiologist, I get to work with most of the physicians in the hospital. Here are the hardest residencies from 5 to 1. And starting at number 5, I'm going to tell you it's OBGYN. Why is OBGYN residency number 5? It's not because the hours. OBGYN residents actually typically spend only about 60 hours a week in the hospital, maybe a little bit more, maybe a little bit less, depending on which program you go to. But the reason why OBGYN is so stressful is because it's either you're going at 100 or you're going at 0. And that's because delivering a baby is very, very exciting and nerve-wracking and anxiety-provoking and stress-provoking, not only in a natural birth, but even a C-section. Typically, C-sections that are scheduled are not as anxiety-provoking as C-sections, which are crash C-sections. Now, what are crash C-sections? It's when the baby starts to have deceleration, so their heartbeat slows down. Why does that happen? It's one of 3 reasons, but the main reason that, predominates is decreased blood flow to the fetus. Any which way you can have decreased blood flow, whether it's the clamping of the cord or the compression of the head or other maternal factors. The baby's not getting enough oxygen. You have about 7 to 12 minutes to get that baby out of the mom's body. Because of that, usually there's a lot more stress added to the residency because you can't really mess up, and teaching and learning on the fly in those emergency situations a lot harder than people think. So that's why OBGYN makes it in at number 5 on the list. Now coming in at number 4, emergency medicine. Why is emergency medicine on this list? Well, emergency medicine residents typically work only 36, 48, maybe 60 hours a week when they're doing their emergency residency rotations. Now obviously this changes when you're doing ICU and other floor work. When you're in the ER, it's typically shift work even as a resident. So that makes their residency actually a lot more flexible, and they actually have a lot more time to do other things. The reason why this residency is so stressful is because once you become an attending or once you become a senior resident, you start to carry more patients. And emergency medicine, as the name suggests, has to do with emergencies. And whenever you're dealing with emergencies, that makes it a little bit more anxiety provoking, just like OBGYNs. Why is it also tough? It's because emergency medicine doctors are the catch-all for the entire community. This means they have to not only deal with mental crises, common cold, kids getting hurt, life-threatening emergencies like injuries, traumas, heart attacks, strokes, but they also have to deal with social issues. So that means placement of parents or loved ones that don't have anywhere to go, children who might be getting abused, police, custody people, patients, criminals, potential criminals. It's a lot of different social factors, plus the idea of carrying multiple patients, of which 1, 2, or 3 might even be having true emergencies. It's much harder as you get later in your stages of training and your early years as an attending. Let me tell you honestly, balancing more than 4 patients at a time is very tough. Sometimes ER doctors can be balancing 6, 7, 8 patients at a time. When they do this, there's a lot of mental drain and mental strain on your head. So this makes emergency medicine residency number 4. Number 3, I'm going to lump the entire field of internal medicine. Internal medicine is a very, very demanding field, but not in the way you think. The majority of internal medicine has already been kind of set algorithms. Because of the algorithms, you just work it down. If you have high blood pressure, if you have an infection, if you have a stroke, if you have gallbladder stroke, if you have any of those kind of issues, the algorithm kind of tells you what medicines you should prescribe, what tests you should order, what kind of different modalities you should go down. The reason why internal medicine is so tough is because sometimes overnight, and especially during the day, if you're on a busy service, you could be managing 10 to 20 patients at a time, talking to multiple different services. So the heart doctors for heart attacks, the brain doctors, neurologists, neurosurgeons for brain issues, surgeons for general bowel issues, nephrologists for the kidneys, infectious disease for infections. You're managing a lot of different inputs into one patient, and you have 10 to 20 of those. During residency, this can be very tough. I did an internal medicine intern year. I can tell you some of the hardest times were night shifts as an internal medicine resident. It's because not only are you covering your team, you might be covering 2 or 3 teams simultaneously, and you're covering all the patients on the floor, and you're taking new consults. So it's a lot of different moving parts, and being able to compartmentalize and organize that in your head is a lot harder than it sounds. So that's why internal medicine comes in at number 3, because of all the different moving parts that you have to kind of bring together and get into a close, tight-knit answer for your patients. Coming in at number 2, the one you've been waiting for, general surgery residency. The reason why general surgery residency comes in at number 2 for the second hardest residency program out there is because not only are you doing surgical stuff, but you are also managing sometimes the same amount of patients as internal medicine. So everything that I said for internal medicine applies to general surgery. But on top of that, you're managing the surgical complications and the surgery itself. You have to learn how to operate. You also have to learn how to treat medical conditions on the floor for your patients that are surgical patients. Now, if you didn't know, when you get admitted to the hospital, you either get admitted to the medical service or the surgical services. The medical services typically deal with medical stuff. The surgical services typically deal with surgical stuff, but sometimes, not sometimes, most of the times, those planes intersect. When they intersect, you're not only treating someone's gallbladder disease, you're treating their hypertension. You're not only treating someone's bowel disease, you're treating an infection. So all these kind of moving factors, and especially because general surgery residents work some of the most hours out there. What do I mean by most hours? Well, typically the max you can report is about 80, but general surgery residents easily work 80 to 90 hours a week. Now, along with general surgery, I'm going to lump in all the rest of the organs that are there. So urologists to an extent, transplant surgeons to an extent, anybody that does any sort of general surgery offshoot, like minimally invasive surgery with robotics, all these different types of surgical fields also kind of get lumped together, and that's why I'm making it number 2. And number 1, above all, the hardest residency ever out there still for all time is neurosurgery residents, and this is for a multitude of reasons. Number 1, neurosurgery residents easily spend 100 hours a week. Number 2, the residency itself is almost a decade long. Most residents spend 7 to 8 years in training, and then they do a fellowship after that. Number 3, these are some of the sickest patients out there. Number 4, there's no sort of algorithm for neurosurgical patients. So if you have a tumor over here versus a tumor over here, it's a completely different surgery. And there's a million ways that you can have tumors inside your head that you have to get out, and this neurosurgeon has to devise a plan to get to that tumor the easiest way possible. Not only that, neurosurgeons deal with the vasculature of your brain. So if you have an aneurysm, if you have a brain bleed, they have to go in and fix that without messing up the rest of your brain. Because if you mess up your brain, then life's purpose gets all messed up in the process too. All that plus the fact that a lot of neurosurgical patients are in extreme amounts of pain because you're dealing with nerves, and neurosurgical patients are most of the time very sick medically as well. So neurosurgical residents not only have to be the smartest, brightest, most hardworking, most dedicated individuals, but they typically can't have much of a life outside of neurosurgery itself. They have to basically turn over their entire existence to the idea of becoming a neurosurgeon. This is why the anecdote that when people say, hey, at least it's not brain surgery, makes entire sense. Let me tell you, the neurosurgeons are the kings of the hospitals. Everybody listens to them. They drive a lot of revenue. They also do some of the most complex surgeries out there, and they're not easily replaced. These guys make a lot of money, and they make it for a good reason. It's because neurosurgery is not easy. So if you want to be a neurosurgeon, you're going to have to work very hard. You're going to be the top of your class, and you're going to have to spend endless amount of hours. Back to the original point, if you stuck with me the entire video, neurosurgeons can literally still be called residents, because I've seen neurosurgery residents do 12, 14-hour shifts, go home for 2 hours, come back, do another 8-hour surgery, and then start another full day. So when the period of 48 hours, they might have went home for about 8 to 10 of it. So neurosurgical residents are still technically residents. So if you like this video, please do me a favor, like, subscribe, and please turn on the notifications. Do me a favor, follow me on my other socials. I love you guys. I'm doing my best. Put in the comments what you want to hear about next.